The biggest challenge in Washington today is clearly focused on covering more people, not in adding value or containing cost. To be sure, adding more coverage for people is a laudable goal. We've suffered for many years with an inequitable healthcare system that's left many people out. So many experiments are going to be offered, from adding health insurance exchanges, expanding Medicare and Medicaid, or even having individual and employer mandates to cover more people. Our biggest concern is that if we add more people to the healthcare system without changing value or lowering costs, the system will become unsustainable. Under healthcare reform, my hope is that we'll change three elements: how we pay for care, what we pay for, and how healthcare is delivered. There are some quick and easy changes in how we pay for healthcare. Some people have proposed just cutting payment rates for Medicare and Medicaid, and those are short-sighted and unsustainable types of changes. Our hope in the Center for Value-Based Insurance Design is that we also shift what we pay for, that we think about paying for value-added services and having less generous coverage for those services that don't add value, leaving funds to cover everyone. The third part of this, though, is changing how we deliver healthcare. At the provider level, we need to make changes in the use of information technology and best practices. At the insurance level, we need to make more and better use of preventive care services. And at the delivery system level, we need to think about making a process that is more efficient and less wasteful. Our biggest obstacle to change right now is that the American healthcare system works well for many people. Sure, we're worried about the 50 million people who don't have health insurance, but that leaves us with over 250 million people who do have health insurance. And of those, 14 million people actually work within the healthcare system. They're afraid of change and afraid of losing control. There are many leaders now who want substantial change in the healthcare system, and they're being criticized by having the great get in the way of the good being providing more insurance coverage for people today. I would flip this around and say that we're letting the good, moderately good healthcare system we have now get in the way of undertaking great changes. If we are to see great improvements in our healthcare system and to substantially add value and lower cost, then we might have to let the good take place now, to have expanded health insurance coverage for those that don't have it. But in the long run, we must look for the great. We must change our payment systems and improve the delivery of care to ultimately lower cost and provide value to all Americans.